When you tell people all the pharmaceuticals, all the procedures, all the scans that we do, all the injections that people get, we've gained 3 years. That's embarrassing. Who wants to live until they're 76? We had a baby, I was 50. I was changing diapers when I was 50. I want to be around for these guys.
Yeah.
And that's so important. And you do as well as a young mother. We want to be around, and you don't want to be sitting on the side at so-and-so's wedding. You want to be dancing at the wedding, and you want to be traveling, and you want to be, your kids and your grandkids are like, let's go stand up, paddle boarding. And you're like, yeah, let's do it.
What if your cardiologist told you the secret to a healthy heart wasn't in a prescription or a procedure, but on your plate, in your environment, or through your mindset? That's what our guest today practices. Welcome to the Vibrant Wellness Podcast. I'm your host today, Dr. Brooke Stubbs, and I'm joined by Dr. Jack Wolfson, a board-certified cardiologist and Amazon best-selling author of the Paleo Cardiologist. After a decade of performing complex cardiac procedures, Dr. Wolfson walked away from the hospital system to revolutionize heart care through nutrition, lifestyle, and root cause medicine. He and his wife, Heather, are the founders of Natural Heart Doctor, where they help people worldwide prevent and even reverse heart disease naturally, without losing sight of the bigger picture, living fully and vibrantly. Welcome to the podcast.
Thank you so much, Dr. Brooke. Pleasure to be on here.
Oh my gosh, it's so nice to meet you. Okay, so you spent years in a traditional medical setting. I know that cycle very well. What led to you leaving the traditional bedside medicine in order to get into what you're practicing now, which is natural holistic?
Yeah, it was pretty interesting. I'd like to say that I was born into the cardiology world. My father was a cardiologist, so I'm in my mother's womb listening to conversations about heart issues. My entire life, I wanted to be a cardiologist like my father, and that's exactly what I would do. I would go where he was a professor at the Chicago College of Osteopathic Medicine, then 3 years of internal medicine, as you know, 3 years of cardiology. And then I get job offers all over where I wanted to move from Chicago to Arizona. So my career was really starting to take off. And unfortunately for him, he was getting sick. In his mid-50s, he was diagnosed with depression, tried on pharmaceuticals, didn't work. It turned more into a movement disorder that was eventually labeled as Parkinsonism, tried on Parkinson's drugs, no success. Finally, at the Mayo Clinic, they diagnosed him with progressive supranuclear palsy. And they tell us there's no reason, there's no treatment for him, and they have no reason, why. There's no cause of why he's sick, because we asked those questions, and he'll be dead within 3 years. Well, simultaneously, serendipitously, and really God intervened, and God introduced me to a young chiropractor who very quickly told me all the reasons why my father is sick and dying. So the chiropractor, she's got all the reasons. Mayo Clinic has no reasons. What she said it just made total sense. And she basically said, if you want to help people, if you want to save yourself, you're going to change. Because I was exactly like my father. The way that we ate, the way that we drank, the way that we slept. He was a cardiologist. I was a cardiologist. Radiation exposure, working in hospital systems, night call, weekends. We all talk about the benefits of sunshine. How much sunshine does a Chicago-based cardiologist get
Not very
on
much.
an annual basis? Not much. So anyway, so that was my epiphany moment. I tried to change things from inside of the biggest group in the state of Arizona, of which I was a senior partner. I tried to change things from the inside, but I was getting in too much trouble, too much friction, as for all the reasons why you and all the listeners already know. So I would leave the big group, start my own company, Natural Heart Doctor, in 2012. And here we are.
I love it. So when you talk about all of these natural things, tell me about the transition from how you were eating to what you and your father then implemented after that. Give me some of the breakdown of what that looked like and what you experienced.
Well, as you know, we get no training in nutrition and no training in lifestyle through all those years of everything that we do. It's all, from day one, it's pharmaceuticals and surgical procedures. And as I started to kind of break out of the matrix, or kind of like just crack this, foundation that you have, and redo everything, the first thing you're going to do is talk about nutrition.
Yeah.
Now, when it comes to nutrition, back in 2000, and I was talking about this with other cardiologists at the recent, Vibrant meetings, and I was talking about the 1999-2000 debate at the American College of Cardiology meetings in Orlando, and the debate was between Robert Atkins of low carb fame and, of course, Dean Ornish of low fat fame. And these guys hated each other. They absolutely hated each other. But I walked out of there and I said, the low carb Atkins plan really made a lot of sense. Now, I was also a 28-year-old, 29-year-old in Chicago and all the foods in Chicago, so I really didn't follow it then, but it kind of set the stage a little bit for my understanding. And then I started reading books like Nutrition and Physical Degeneration by the late Weston A. Price, who's a dentist in the 1920s. He travels all around the world by boat with his wife, and he goes across and he sees all these native cultures and the foods that they're eating. And the book and the pictures from the book are just spectacular about the health and vibrancy of the people who are living really this paleo lifestyle in addition to the nutrition. So it really wasn't a matter of, should we study this or not, or what the research says. It just became a matter of common sense. And then ultimately, other books that were kind of along that paleo idea. And then 2015, I would release my book, The Paleo Cardiologist, The Natural Way to Heart Health. And it's not just about diet, of course, as you know, it's really wrapping up the full spectrum of everything that we now talk about, many years later.
And when we talk about nutrition, you are the paleo cardiologist. Tell us what that looks like and how you help your patients implement it. And then I also want to talk about what things, what metrics, what screening labs, or what do you follow to make sure that the patients are implementing this in order to actually help with their outcomes? Yeah,
well, I think, first of all, outcome measurement, no matter what we discuss, right? No matter what plan is, the measurement is really, that's going to be the key. So by doing the most advanced lab testing in the world, that's going to give us the information that we need as physicians, of course, that patients need to make sure that they're on track. And it used to be back in the day, right, where it was like, take 2 aspirin and call me in the morning. But now there's so many opportunities to learn so much more about what I call root cause cardiology. And that's really kind of been the main thing that we've been doing. As it relates to nutrition, our ancestors ate a certain way since the dawn of human existence. We're hunter-gatherers. We don't have to reinvent everything. One thing that I like to say is that if we can all agree on eating organic food, like that would be a great start. So whether you're vegan, vegetarian, paleo, keto, carnivore, let's get the chemicals out of our food. I don't think there's many holistic practitioners who are debating that conversation. But as you know, there's so many different options of what people are doing. As we talk about plant-based. There's people, of course, who talk about meat-based. I just believe that our ancestors, they would go on the hunt and they would gather, they would eat plenty of seafood, they would eat plenty of free-range grass-fed meats, and that's all that we consume. I'm not an 80-20 guy. I'm not, do the best you can, or in the house we do this. For the people who know me, I am very hardcore about this. For the people who care, which you don't, I'm wearing organic cotton underwear. We take the lifestyle very, very seriously because number 2, that's how people get the best results. But number 1, I do it for me because I don't want to die.
Right.
Like my father died at 63 and everyone's walking around like, how'd that happen? And then you learn the truth about how it happens. And everybody's got their own sickness. Not everybody who does the wrong foods and the wrong lifestyle gets PSP, but we're all getting something, right?
So. Well, it's whatever the genetics underlying and then the epigenetics that turn on that light switch. And so when we talk about those epigenetics, of course, diet is a huge part of that, but there's other things too. Like you talk about the sun, circadian rhythm, you're talking about organics and toxins. How do you approach that with your patients?
Yeah, I guess quite simply, it's kind of like, get all the poison out of your house. Whenever you are thinking about buying something, just consider the ramifications. Are you buying something that's a toxic poison? Or are you buying something that's natural and organic? And if you are making that decision, then choose the one that is natural and organic. And these days you can get any of that stuff. Like there's really not many excuses. You could say, well, organic's more expensive or this is more expensive. It's getting pretty darn close. And the more that we support that, of course, the more people will continue to sell that.
Right.
So if you started in this industry 20 years ago and you're like, where would I find an organic mattress? And now there's probably 20, 30 companies that sell organic mattresses because that's what the public demands. The physicians won't demand it, but I think that the public will. And that's where we have to really embrace it.
Let's talk about physicians in terms of your background and how you transitioned from what was just a traditional Western cardiology setting. When, if you're talking to somebody like me, where I also too left a traditional bedside setting, I still implement some of those Western ideals in my practice. And certainly I haven't gotten totally away from pharma, but I have, since my eyes have been opened to the idea that maybe it's not everything that we learned in medical school, that there might be a different way. Certainly there's a more preventative approach that, like you say, we did not learn in our education. So tell me more about what does that look like when somebody is coming to you, if they have some cardiology issues, if they have plaque. What does that look like on labs? How do you adjust those labs, if at all? Cholesterol is a big component of that. Give me some idea of your approach to that.
Well, I think that it is a wonderful thing in a free country to be able to offer people a whole menu of things and providers, and then let the person decide what they gravitate towards and then choose that. So if someone wants to go vegan, vegetarian, paleo, keto, whatever they want to do, okay, fine. You learn the information and then you decide what works for you. And then of course, try it out. And then you could check labs and see how your numbers look and use that as the metric of success. But it really just is about a freedom thing. So if I want to be on one extreme of pharma absolutely last, and of course there's plenty of doctors who are pharma first people who believe that statin drugs should be in the drinking water. Like they believe that. And I was around all those doctors who believed it then and they believe it now. But just offering people different approaches. So many times it's kind of like from your career where this is the cancer, this is the chemotherapy, this is the protocol, and there's no conversations for anything else. And I just think that people deserve better. They deserve choices than just this one particular way. But, and it's all, again, about freedom of information. Like, hey, listen, I'm going to put the information out there. Let me be free to speak my truth. And then if people want to come see me, great. If they want to see somebody else who, thinks statin drugs first, if they think LDL of, with some of these new guidelines of LDL below 55, if you want to go see that person, go ahead. I mean, I've got no problem with that. It's not for me, but you can do what you want.
Yeah. And when we talk about this, like the LDL, what's your perspective on cholesterol labs? Should we be following cholesterol?
Well, I do all my lab testing through Vibrant. I do everything, through them. And the main lipid marker that we would look at would be the apolipoprotein B to A ratio.
Okay.
The lower the number, the better.
Okay.
Now, how do we get to that lower the number? That's, that's a different story about how we achieve the optimal. But I look at it as if there is a problem with that ratio, we need to figure out why. And the problem is not a statin drug deficiency. If we are not clearing out ApoBs, we want to know why we're not clearing them out. And typically it's going to be a hepatic issue. It'll be a problem with that apolipoprotein B LDL receptor interface, where maybe there's toxins that are there that are kind of inhibiting the binding of that old oxidized LDL particle. Which takes me to another point. I love doing OxLDL testing as a measure of oxidative stress. That is wonderful. LDL is a purpose. That's why humans make it. That's why all animal species make LDL and they make HDL. It's not the bad cholesterol as pharma would have us believe, and HDL is not the good. I mean, there are damaged particles in both, and if they are dysfunctional, you are going to wind up in trouble. Of course, Lp(a) is a marker that we've been checking for many years, and it should be checked on everybody. The other markers of inflammation and oxidative stress are all very important. Of course, homocysteine is very important. all of the, the uric acid and the other hormonal levels, critical. But then also looking at things like intracellular vitamins and minerals and proteins and fats. One test I love is intracellular vitamin K2.
Okay.
As you know, K2 keeps calcium in the bones and out of the arteries. Wouldn't you want to know like your intracellular levels, and no other company in the world, test that? So it's very exciting in that sense to be able to have that. And we know the importance of CoQ10. What are your levels? Omega-3 fatty acids. What are your levels? People with the highest levels of omega-3, lowest risk of everything when they get there naturally. So, those are some of the big ones. It's kind of funny. You'll get a kick out of this too, I hope. And maybe the audience will. But when I met my wife, early on, the woman who would become my wife, this 29-year-old chiropractor, and she starts talking about leaky gut.
Yeah.
And I'm like, where'd you come up with leaky gut? What's kind of bogus chiropractic diagnosis is that? And she said, go read about it, smart guy.
Right.
And I went to go read about it, but there wasn't much in the medical literature. Well, now, of course, over the last 15 years, the literature has exploded on intestinal hyperpermeability and leaky gut. Of course, the ability to test it with the best, lab testing in the world is very, very exciting. And that whole concept of, health starts in the gut. So stool testing, gut zoomer testing, the leaky gut analysis. I love the anti-lipopolysaccharide component.
Okay.
I love the anti-actin component. If your immune system has antibodies targeting against actin that are in all of your muscles, including the smooth muscle of your coronary arteries.
Yeah.
And we're still talking about cholesterol being the problem, and we're still talking about driving LDL down to zero. There was at the recent Vibrant conference, some gastroenterologist started talking to me about some of his health issues, and he's talking about how to get numbers down. I'm like, you're a gastroenterologist. Why don't we just perform a hepatectomy on you? Like, let's just remove your liver, and your cholesterol will go down to zero, and you'll never have a heart attack, allegedly. And he looked at me like, okay, that's interesting. So, what I'm all about is about optimal levels of everything. Every one of us is given a God-given number, evolutionary number of perfect for us, and it shouldn't be total cholesterol, under, 160 or LDLs down to 55 of these things. These things all be celebrated. And then wrapping up this final point regarding testing, I'm a huge toxin testing guy.
Okay, great.
I'm at this point right now where it's kind of like, if somebody had to choose one test, if they're like, I've only got so much money to test, I would go toxins first, because then you can show people, hey, this is real root cause here about the toxins. And now that you've identified those, then how do we work on getting them out and avoiding them in the first place, which is so critical.
Yeah. And what is that advice? Because you talk about OxLDL and oxidative stress, and then you're talking about these toxins. I mean, what do you say to people? Obviously, you live the lifestyle. This is you. You are living in a tent in Fredericksburg. You have the organic cotton underwear. Like, what can people do when the oxidative stress in their body is high, and then when they're seeing high bisphosphonates or phthalates on this lab work? Yeah,
it's not easy, right? I mean, we're living in a pretty toxic world. I don't know if it's getting hotter or cooler. I'm not going to play the climate change game, but I do know it's polluted. That's for sure.
Yeah.
And, there's so many studies that show that bisphenol A and phthalates and the other components of plastic markedly increase the risk of cardiovascular disease, brain disease, hormonal disorders, so many factors there. And then how do you get people to avoid it? Again, it's just a matter of laying out the truth, laying out the facts, and then it's up to them to do something about it. And people, when they're really sick, they'll be pushed. But how do you be proactive about it, right? Or maybe the woman feels a lot of symptoms and the man doesn't, and the woman's like, oh, we got to clean this and change this. And the man's like, whoa, slow down there, with the organic mattresses and organic couches and the clothing. It's not easy. It's very easy to tell someone, hey, eat less sugar, eat grass-fed meats, get more sleep and sunshine. But you talk about the toxin component, and then, of course, the big one there is going to be mold and bacteria, which Vibrant does not test for water-damaged bacteria. I'm not aware that test exists. But I do think, though, that the anti-lipopolysaccharide in the wheat zoomer analysis does provide that information, because again, like, where is those lipopolysaccharides coming from the gram-negative bacteria? So they're coming in through the leaky gut in the intestines that are permeable. You can certainly could also be leaky teeth, obviously, if someone's got, dental issues. But I think also that there is the potential that these environmental bacteria, that we do breathe them in, we do swallow them down, and then they can translocate. So I think it's just when that number is elevated for a whole variety of reasons, it's a good warning sign, but it's also, hey, you may want to test your home for the water damage bacteria as well.
And have you heard, this is a side note, have you heard of them being in certain medications too? Lipopolysaccharides?
The answer is I have not heard that.
Okay. Injectable medicines. I've heard it. Maybe not on maybe not those that are tested, but.
Well, maybe by contamination.
Contamination.
They're contaminated. I think the other thing too was interesting. I found this study from 2005 where the researchers were coating certain pharmaceuticals with gluten.
Okay.
So they were putting gluten on the outside in order to induce intestinal permeability to increase the uptake of the pharmaceutical, to actually puncture the holes in the gut in order to make that happen. So just kind of highlights the problem with that. I used to be a lot more anti-gluten than I am now. So if you're like, oh, what about fermented sourdough? I think for most people, they can probably do it. Yeah. I know there's a lot of people who we're friends with who would be like, that's still anathema to them. And I don't really do it because I don't feel like they need to. But some people do. And I think that they can probably, enjoy that. But I think ultimately, it's all these toxins, they destroy the gut microbiome.
Sure.
That's going to be, that's how it's done. And now you've got intestinal hyperpermeability. That leads to immune system activation, inflammation, oxidative stress, endothelial dysfunction, autonomic dysfunction, heart attack, stroke, dead. Okay. And the average cardiologist doesn't have a clue. Yeah. And it's not because they're not intelligent. It's just, it's like if you and I went on a trip to, I don't know, Namibia, and we're walking around like, oh, look at those two Americans. They're so stupid. They don't speak our language. Like, we're not stupid. We just never learned that.
We just never learned it.
The medical docs never learned it.
Yeah.
So.
And I do think that, cardiologists, people, when I just think back to when I'm in the hospital and we're doing the most, like we are saving lives in real time. Then you come in for morning rounds and a guy you just saved through a heart catheterization, he's eating biscuits and gravy, and you just know he's going home, and there's not going to be anything that actually is going to change in his life that's going to keep him from coming back. I think that was one of the wake up calls for me, was that not only was I experiencing symptoms I didn't want to be feeling at a 30-something-year-old woman in the prime of my life, but we are very good at acute medicine, but we aren't so good at preventative medicine. And I think that I love these conversations because they are getting integrated. I mean, this is just an example, and I don't know if you are in, I know you're not much in the hormone world, and of course that's pharmaceuticals, but another conversation I was having with a patient of mine, and they went to a different specialist, and I'm like, oh, that's interesting. So now they'll think about that. And whoever's listening to this, a provider may think about a toxin test and talk to their patients about how to avoid those in their overall environment. How do you, once you have those forever chemicals in your body, what can you do about them? Is there a sauna? What is it?
Yeah, I think, there's a lot of great obviously, the foundation is going to be eat well, live well, think well. That's the foundation always. And then, of course, are there other biohacks, which could include evidence-based supplements, could include sauna and red light and all these other things that we do. Undoubtedly, it's all going to be helpful. So avoidance and then detoxification is always critical. When I left the big cardiology group in 2012, nobody was sad to see me go, as you would imagine. They were kind of pretty happy that I was.
Did you ruffle some feathers before you left?
They were pretty. I said a lot of things that and it was interesting because the head of the group, he was like, I totally agree with you. The woman who's going to become my third wife, she's all on board with natural. She's totally. I'm with you. But what you're saying is bad for business. So you got to stand down. And I said I quit. But when I would towards the end, like the last couple of years, writing orders for diets, right? So I would write into someone's charts, organic, free range, grass fed, gluten free, and I'd get a call from the dietitian. Yeah. They're like, Dr. Wolfson, we can't do that. I'm like, yeah, I thought I would try. Because you're right, like the stack of pancakes that people were getting with the sugar-free syrup, just so much wrong on every level. But the hospitals don't care because it's a revolving door. That's how they make their money.
Mhm.
And once we started to learn the truth, we could have done some amazing things inside the hospitals,
I know.
but we were not able to do so.
I hope that that's still coming. Like, I think that people are opening their eyes. I hope that diet and nutrition and between you and I, even though I follow mostly plant-based diet and you're mostly paleo, there's a lot of things that we agree on. And I think if we could settle on the healthy factors in a diet, we could do a lot of good instead of people like us not agreeing to disagree. We could agree on some really profound things. In fact, I think you can be very healthy and have meat in your diet if it's well sourced. And so I tell my patients, have meat as much as you're willing to source it very well. And for them, that's not very often. And maybe that's different for you. And, each person, you're saying has a different path. So neither here nor there. But what I'm saying is that I think as a whole, we could come together to really make a big change for everyone. And I think, wouldn't it be lovely to blend that preventative medicine and these really profound tests with what we already know? And I think that there's just so many right fighters right now on their, standing on their soapboxes, and we're not coming together.
Well, there are, it's going to come from the public, right? So
Mhm.
it's like enough people are going to just be in the hospital and be like, because some other hospital may offer something that's different. So, for example, Cancer Treatment Centers of America,
Mm-hmm.
they have a location out in the west part of Phoenix in the Arizona Valley out there. And they actually had an organic farm,
Okay.
McClendon Farms, put a farm
Uh-huh.
on their property, and they would serve that to patients.
Uh-huh.
So
That's so
if
nice.
people hear that,
Yeah.
they're going to choose to go there. So it's going to be the economics that drive it. It's going to be the patient's demand, because it's not going to just come from a hospital necessarily saying,
Yeah.
I think this is the best way, or, some big system saying,
Right.
I mean, when I was a medical student, I was at the Cleveland Clinic, and I was at the McDonald's in the lobby of the Cleveland Clinic.
Mm-hmm.
And now it's been removed, but it is a matter of, us kind of voicing that. And to your point, if you're in the hospital and you want an organic, raw vegan diet, then you should ideally have that. And I understand it's expensive and these are not
Uh-huh.
easy, but I do believe that we should have that choice. And I do bash the medical doctors very often, but I will say to what you just mentioned before is that bless the men and women who work in emergency rooms and trauma centers, no doubt. But when it comes to prevention, they have, as far as I'm concerned, they have
Mhm.
nothing. Medicine has nothing for prevention. They have
Mhm.
early detection.
Mhm.
They've got all the different treatments, but the prevention and the reversal,
Yeah.
nothing I know of. It's certainly not statin drugs, and it's not blood pressure drugs, and it's not aspirin and bypass surgeries. Those are all Band-Aid approaches, and
Yeah.
they fail.
Right. So you mentioned Dean Ornish as part of the leader of that plant-based kind of revolution. And I, because of my background in lifestyle medicine, have seen his paper on the reversal of these coronary plaques. Tell me about, what is it you follow in your practice to ensure that these patients who are, because you say it's really hard to live this really toxin-free, organic lifestyle and to make the right choices. I mean, we're inundated with poor choices, and it's swimming upstream out here for a lot of my patients. So sometimes I want to give whatever I can to lower their risk, and maybe that does include a medicine, but then what would really, I'll tell them that's a Band-Aid for what's going to be a more systemic problem. If it doesn't present as heart disease, it may present as dementia later, or, whatever their genetics may make them prone to, end up phenotypically representing. So when you talk to them, and you give them all this advice, how do you make sure that it's actually making a difference?
So what Dr. Ornish did was that he was able to demonstrate plaque reversal. And he did so. Those people all had angiograms. So this is before, CT scans and CT angiograms and clearly scans that people are doing now. and he also used a multifaceted approach. So it was about plant-based, but it was also about other factors,
Sure.
right? Exercise
Yeah.
and yoga and mindfulness. So many different things that I think led to health improvements. Now, I don't order CT scans.
Okay.
I never have, and I never will. I call it the CT scam.
Okay.
So what I use to determine our success is the lab testing. Is
Okay.
that if we take someone and they have all these kind of things that are in the bad column, and then you get the good column, how do we move and can we measure the things and moving them all from the bad over to the good side?
Okay.
And when we do that, that's our success strategy.
Okay.
I find that the CT scan, it's radiation. And it doesn't change what my plan is going to be if they have coronary artery calcium. I'm not going to prescribe a statin drug. I'm not going to prescribe an injectable like Repatha or similar. I'm going to use our methodology of, eat well, live well, think well, do all the testing, evidence-based supplements, biohacking strategies, and then again, repeat the test down the road. And the beauty of the testing is that it can change very quickly.
Sure.
And when you see those changes, then you can say, this is great, continue on the plan. If you're not where you want to be, because there's still residual things and toxins and inflammatory stimulators and oxidative stress stimulators, then it just kind of keeps you peeling back on that onion. The problem, again, with mainstream is that when you go with a statin approach, you lower heart attack risk from 2% to 1.84%. And if somebody wants that, a patient wants that, well, then go to one of those doctors who prescribe. But if you want a 0% chance, I think that we offer that and the other people don't. But, it's, people have freedom of choice.
Good, because when you talk about reversal, you truly believe, and I do too, that most of what we see in cardiology is preventable. What is the percentage you think that of these heart diseases, heart attacks?
100%.
100%.
Yeah.
Yeah. I mean, and that's very empowering for our patients. Do they come to you and they're like, you've changed my life. I feel so much better. I mean, I'm sure you get that all the time with your.
Oh, every day.
Yeah, every day.
Of course, listen, there's so many different things that are out there in the world, so many toxins, so many poisons. So I guess when people talk about genetics, right? So I'm much older than you. So when I was in medical school in the mid 90s, everything was all about the Human Genome Project.
Sure,
and we're going to learn everything from that. It's going to tell us so much.
And we're like, oh.
And what we learned from that is what you said before, like it's all epigenetics.
Yeah.
I believe we are here built in the image of God. Or if someone, again, evolution, whatever somebody wants to believe, you and I don't have to have that argument right now. Although I believe you and I would be similar minded. But again, like whatever someone, we're here and we're perfect. I mean, you can.
We're not perfect because of sin.
Thank you. Okay. So thank you for clarifying that.
Okay.
We are built. Can I say we're built perfectly? Are we built perfectly?
Everything has its reason.
You can, you're a woman who can see and hear and smell and taste and run and jump and make babies. Yeah. The miracle of what a woman can do. And yes, the men get some credit. Where does bad genetics come into that mixture? Where's the heart attack gene? There's not. Where's the dementia gene? Like you said, it always has to be stimulated. I believe in a world where there wasn't the poison, where everybody was eating organic and free range. The only way we get sick is when someone threw a spear in our back, or maybe there was, birth trauma for some reason. We weren't dying of heart attacks. And it's not because everybody died when they were 40. Like we didn't. So ultimately, I think, and this is the beauty again of the testing is that you can use genetics to help dial in certain things. And maybe that genetic, because it's not a nuclear test, it's not a radiation test, that could be very empowering to people. Like, okay, I do have a family history, and family history is true because we eat, live, and think like our family members did. But if someone says, okay, I've got the ApoE44, I had family members, okay, I'm going to take this a lot more seriously than the other person who's like, oh, everybody smoked and drank until they were 105. Yeah, they've got more leeway, those people, historically. But again, hopefully we can use this information to really open up people's eyes and say, yeah, you're inflamed and there's no pharmaceutical that we're going to give you for inflammation, or we don't have any pill that reduces oxidative stress.
Right.
So we got to really hit that root cause.
Yeah, I love that. You keep talking about mindset. It's something that I feel is so important. Tell me what your belief is on mindset and how that affects our health.
Well, it's when we talk about this kind of concept of maybe thrival nutrition, thrival lifestyle, thrival mindset, they're all equally as important. But we just, as medical doctors, right, that we just don't get the training in mindset, finding you're happy. There's so much anger, anxiety, fear, worry. 2 medical diagnoses from a cardiac standpoint. One is called Takotsubo cardiomyopathy, which is broken heart syndrome. Very common and much more common now more than ever in this kind of 35 to 60-year-old woman. She gets into a fight with her boss, having problems with her spouse, financial, and then boom, she has this, what appears for all intents and purposes, is a massive heart attack. There's no coronary artery disease there. It was a spasm, that happened. The other is called spontaneous coronary artery dissection. Same scenario, can be associated with pregnancy as well, or in the post-pregnancy, postpartum period. And the woman has a massive heart attack, which is caused by a dissection of the coronary artery. So stress is bad. And we need to wake people up to the fact of, A, you need to de-stress, or you're going to have an event, or after an event, get a hold of people. Because every time, right, you take a history, and maybe you in the cancer world, if you took that history on the cancer people, like, yeah, I had a lot of stress. Because what happens ultimately from a physiologic standpoint, pure sympathetic drive, no parasympathetic tone, your body's in fight or flight, your body cannot detox, cannot repair, cannot heal, all these things. So there are all these physiologic mechanisms. And if there's one thing we learned over the last 5 years, social isolation, distancing, it's absolutely devastating to the individual person. And ultimately there's always a better way. Foster those good relationships, find community, find love, find spirituality, find prayer, find gratitude, find safety and security. All those things are, find your happy. So important.
Yeah, I agree. And we talk about religion, even though that's a kind of a controversial topic, but we do know from studies that people who have a spiritual based practice tend to live longer and have less chronic disease too. So it's not for nothing to mention something like that.
Well, I think, there's so many reasons behind that. Even, when we think about the act of eating, and if we pray before a meal, or we express gratitude for a meal and whatever we're praying to. But the whole idea is that you're doing that, and so many benefits of that. First of all, you're blessing the animal. I was on a bison hunt a couple of years ago, and we killed the animal. And then we were out there with members of the Lakota Indian tribe up in northern Colorado on the Wyoming border. And we all just prayed over the animal, and they sang chants and songs about the animal. And when we engage in that parasympathetic tone, now it sets the stage to digest our food.
Oh, I love it.
Which does everything, with us. And so many different things about how kind of like, how God has our back, on this. And we're not going through things. So many people are alone, and they're so afraid, and they're so isolated, and they're in toxic relationships. But when you have that relationship, with God, and this is kind of new for me as well. I was not born into this world, and it's taken me a while to get to here. But as you mentioned, once you read into the literature about all the different benefits, I think we can all probably do with a lot more prayer and a lot more gratitude. Yeah, for sure.
For sure. And you mentioned having those social connections. We also know that empathy, or having an empathetic provider, somebody who is really invested in your outcomes. And then, that social setting, it's so very important to outcomes and health outcomes. And like you say, repairing and replacing those dead organelles and making sure the body is functioning optimally. And it's just as deleterious to have those toxic relationships that you mentioned.
Yeah, it's and then of course, invariably that leads to poor sleep. Maybe it leads to poor eating habits. So that's why they're all mixed in together.
I want to talk a little bit about circadian rhythm, how that looks like in your life. Of course, that's going to affect like cortisol that you mentioned, and how that affects your sleep and your melatonin release. Tell me about what that looks like on your day-to-day basis.
Well, what's cool is that those are also kind of free tips, right? They're free strategies for people.
Exactly.
Anybody can get outside more. Anybody can go to sleep earlier. And I understand there's people who work different jobs. And I mean, there's all different things that people in a modern world can kind of run into. But just getting outside, trying to watch that sunrise. We are fortunate right now. We are in the hill country outside of Austin. And every morning we're getting these glorious sunrises. We spend a lot of time outdoors. That's all free. The sunshine's free. Movement, right? Just getting up and walking. Back in the day, people took cigarette breaks, and now it's sunshine and natural light breaks. So doing all of that. And, why are all of us providers all talking about the same thing? Vitamin D is not about swallowing capsules. It's about, what is the purpose of our skin? Our skin is a solar panel built to collect light. Our eyeballs are solar panels built to collect light. When I first moved from Chicago to Arizona, it was all about, I'm going to get some fancy sunglasses, wear them all the time. And then once you find out, I wasted so much money and all that, all the danger related to that. So it's exciting. But, as you mentioned also, quick doctor visits in the traditional medical office, but the doctors have nothing else to say, right? So what else, hey, Brooke, how are you? Well, you got a family history, here's your statin drug, here's your blood pressure drug, get a stress test on your way out. Like, that's the consult.
Right. Whereas when I'm in my office, an hour isn't enough.
Yes.
Because we're going through everything. We're going through everything in terms of their lifestyle and a schedule for the day and what that looks like and optimizing circadian rhythms and lowering their stress. Sometimes I'll meditate with them.
Yeah.
So they can feel what it feels like to be in a parasympathetic state. Yeah.
So awesome.
So tell me, go ahead.
Well, I mean, our life was a lot easier back then and conventional, right? It was super simple because you just had your menu of offerings was real small.
Yeah.
And then now you're in the office and someone's like, what do you think about EBU? What do you think about, the Hocket? What do you think about tissue plasma exchange? And they're asking all these questions and you're answering them, and all of them take time, and all these different technologies and all these things, they're the supplements of what, can be offered, what should be offered. Yeah. It's so variable.
Well, you're so nomadic right now. How do people work with you? Are you virtual?
So I'm virtual. And I've got another cardiologist, Dr. Andrew Rudin, who works with me. I've got two naturopathic doctors, an anti-aging specialist, and a team of health coaches. So I've been virtual since 2012 because people would come out to Arizona and see me. Okay. And then they go back to wherever they're from. And then we would do, virtual, Skype back in the day or phone. Now it's all Zoom afterwards. But you really, I do believe that telemedicine is just a wonderful thing to be able to offer people. It's great when they come to see you. You and I both like seeing people in person. There's nothing like, the physical contact, the, just being close proximity. Right. But, telemedicine for what we do, where we're just, hey, we're talking about nutrition. We're talking about lifestyle. We're talking about mindset. We can do the most advanced lab testing in the world and review it on a share screen, on a Zoom call. Yeah. And then being able to, continue with these relationships. It's been so fantastic, and just there's so much in the lab testing in the world where we offer people, and it's an exciting time to be a practitioner for sure.
Yeah, and there's so much purpose, and we talk about being there and having the energy of being one-on-one, and like the intuitive nature and how you're kind of guiding these people, and they call you all the time to say how their lives have changed, and it's really rewarding to be in this space.
Well, I think also, it's kind of like when, at the Vibrant conference, recently, everybody there is happy.
Everyone's happy.
Everyone's happy.
There's
you
no
see old
malignant
friends,
personalities.
new friends. Everyone's like kind of like hugging and kissing each other. It's like a big old party. You go to the American College of Cardiology meetings, everybody is angry. All the medical doctors feel they're overworked, underpaid. They're just bitter. And it's just so unfortunate that they haven't found the truth yet. And why they don't, right? It's just you spend a lifetime learning one paradigm and then now being introduced to another. It takes a lot to make that switch.
Yeah, I can speak to that for sure.
I wrote about this in my book, and it's a quote from The Jungle, Upton Sinclair from the stockyards in Chicago in the early 1900s. And the quote goes like this: "It's hard to get a man to understand something when his job depends on him not understanding it. The medical doctors are paid to understand what they understand." And like I said, my old, cardiology, boss, he's like, I get it. It's just not good for business. One of my best friends in the entire world, he's the head of cancer at a well-known East Coast institution. And he's like, Jack, I get what you're saying, but I travel all over the world on pharmaceutical companies' dime. This is my job here. If I don't have this, what do I have? And I'm like, become an integrative oncologist. We need more of those.
Yeah.
But
We do need
we'll
more of
get there.
those.
We'll get there.
I do
We'll
think
get there.
that everybody's so like they want to do what's great and what's right, and but I do think that if we could get more people to integrate what we're talking about, it's gonna open up things in a way that I think everybody's really. I think that the public and the market is really in need of. I have so many patients who've been so let down by, just the traditional medical system, and proud to be a part of a new transition for sure. Okay, last question. You mentioned your wife, and she means a whole lot to you. She was the one who presented all of this a new way of thinking in terms of health. How do you guys live your life together? What's really important? How do you teach your kids? Because kids can be so hard. I think all the time, I have 2 small kids, 5 and 7. So it's like, I'm like, just let them be kids, let them have that. And then I think about my friend she's very regimented in this longevity space, and she hasn't had kids yet. And, she plans to homeschool her kids. So what is your approach, and where do you think, is there a good balance, or is it an all or nothing kind of thing?
We do homeschool, unschool our kids. They, 18, 13, 7, and 4. It's just like a big party. We've got animals, and we do martial arts, and we are faith-based, and we do a lot of outdoor physical activities, and we read books according to our own schedule. And it's the greatest thing in the world, because my father, again, was never home. For the first 5 years of our oldest son's life, I was never home, as you know, as a hospital-based, cardiologist, and the ability now to be with them, so often is so incredible. The relationships that they have, the outdoor abilities, just kind of getting out of the rat race. And yes, everything they eat is organic. Everything they do is, free range, grass fed, 0 gluten, all that kind of stuff. And it's not easy in this world. I mean, it's not easy. They do get treats. We will go for organic ice cream, and we will have gluten-free pizzas, and we do these things, but it's just our stance of how, we want to do it, and we think it works the best for us.
I love it. It sounds lovely. I wish I had a little bit more of that. I'm starting to think of how I could revamp some of the things that we've rested into, but it gets hard. So I applaud you for all of that.
Society, again, is against us, but it can be done. And I think more and more people are choosing that. Certainly over the last 5 years, the homeschool, unschool, communities have exploded. And then we look at kind of like, well, what's happening inside the school in the artificial lights? What are they teaching? For example, when our 2 boys were 9 and 4, they were in a Montessori school in Arizona, and they were going on a field trip to the grocery store to see where food comes from. And my wife was like, food doesn't come from a grocery store. Like, what are you talking about? You have to go to a farm, you have to go to a ranch, but this is what we're doing. It's, as you know, kids are the greatest blessing in the entire world. And I want to be around them every moment. And I think that's the beauty of the career choice that we have, is that we're no longer in the hospitals. I mean, don't you feel so horrible for our former colleagues who are in that matrix?
Well, I feel like it takes all types, and I'm so grateful that they're there, but I know I could never do it. Like it just ate my soul.
It's just the ability to, in our practices now, right, to make your own hours, make your own vacations. I was on call every 3rd weekend. During the week, I worked from basically 7A to 7P. I got paid well for it. It's just the job. And then I was on night call every 5th night. And at any one time, we had over 200 patients in the hospital, and then also tens of thousands of outpatients. So I never slept every 5 nights. You're up all night.
Right.
What does that do to the person? I mean, it's so horrific. And then you spend the whole next day, you're in the artificial fluorescence, you're in all the chemicals in there, and then you're getting blasted by a fluoroscope while you're putting in pacemakers and defibrillators and doing angiograms. it really is a testament to our bodies and how spectacular we are that we could tolerate that onslaught.
Right. All day, every day.
It's our bodies are just these God-given miracles. But we better appreciate it because, as you know, people are getting sicker and sicker and sicker.
Sure.
The heart attacks, the strokes, the cancers in young people. You know, it's so sad. And when
agree.
people learn that, let's just continue to give people the truth. That's all. And then once they learn the truth, it's kind of like, the movie The Matrix, where one of the actors who was like, I don't like the truth. Just plug me back into the Matrix. I just, la, 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 la. I don't want to hear from this.
Yeah.
But we owe it to everybody to continue to speak that truth and say, yeah, when you
you
eat the
know
right
better,
foods,
you do better.
and you better, because I'll say this too, Brooke, is that it's not like either or.
Right.
The life expectancy of the American male, according to the CDC, is 76. Since 1980, we've gained 3 years of life expectancy,
And hasn't it
according
gone
to the
down
CDC.
in the last decade?
And the last, few years.
Yeah.
But it's like when you tell people all the pharmaceuticals, all the procedures, all the scans that we do, all the injections that people get, we've gained 3 years. That's embarrassing. Who wants to live until they're 76? We had a baby. I was 50. I was changing diapers when I was 50. I want to be around for these guys.
Yeah.
And that's so important. And you do as well as a young mother. Like, we want to be around, and you don't want to be, sitting on the side at so-and-so's wedding. You want to be dancing at the wedding, and you want to be traveling, and you want to be, your kids and your grandkids are like, let's go stand up, paddleboarding. And you're like, yeah, let's do it.
Yeah.
And most people are not getting that. They're in and out of the doctor's office, in and out of the pharmacy. And it's a shame, but I appreciate the opportunity for me to kind of share my piece and, fight back against the mainstream.
No, and I think it's important because I've experienced it. You've experienced it. This vibrancy that you get from life when you really do take control and live really intentionally and figure out where it is you need to improve. So thank you so much. This has been a wonderful conversation, and I think we have so much to gain from it. Tell everybody how they can find you. Yeah,
so my company is called Natural Heart Doctor. The Instagram page is natural_heart_doctor. We used to be on TikTok. We were kicked off of TikTok for obvious reasons, if you listen to what we just talked about for a while. But all over Facebook, as well. And I think those are great mediums as well, as you know. That's just where the public is sitting, and just getting out and speaking your truth as well on social media. Don't be afraid to shout the truth from the rooftops. You're going to change people's lives. And if they don't hear it from you, who are they going to hear it from? So we just continue to put it out there.
Okay. And if they want to work with you, they go to, what's your website?
Yeah, naturalheartdoctor.com. If people want to work with me, and then if practitioners have questions, we're happy to answer as well. Any way that we can get health information into people. I've been doing this lab testing with Vibrant since 2016. So I'm one of the early, physicians in there.
Okay.
And so I have a lot of experience with that, especially as it relates to mold and mold mycotoxicity and cardiovascular disease. That's certainly a big one. All this root cause stuff. And it's so exciting and so empowering to give people, really that root cause. So
well, I might be giving you a call myself to go over more of it. All right. Well, thank you all for listening today. And if you want to know more, please subscribe to our podcast, and you can follow us at Vibrant Labs.